Hello, and welcome to another conversation to support your healthier lifestyle. Today, I am delighted to be joined by Dr. Alisha, a naturopathic doctor based in California, who supports individuals through natural remedies, and she has over a decade of private practice experience. Hello, Dr. Alisha.
Hi, thank you so much for having me.
Great to connect today. I thought we could start our conversation by just asking you, what is naturopathic medicine?
Great question. So, naturopathic medicine, I kind of like to liken it. Everyone is traditionally familiar with the allopathic model. That's your typical Western practice doctor who is an MD, maybe a DO, standing for medical doctor or doctor of osteopathic medicine. And then naturopathic medicine is kind of like a blend of two different worlds. So naturopathic medicine encompasses what it sounds like is natural remedies. But we often, if needed, can include Western things like pharmaceutical medicine if needed. So the kind of overarching principles that really guide your experience with naturopathic medicine are a few different things, and I'd love to share those real quick with you. So the principle that all doctors fall upon is first, do no harm. You've probably heard that, and that is so important. And naturopathic doctors really adhere to that. It's really important, obviously, that we're first not doing any harm to patients. And then another principle that we have is treating the whole person. So when you go to the doctor, sometimes if maybe you go for a stomach ache and they're just going to be asking you questions related to your stomach. When you go to a naturopathic doctor, they may be talking about your levels of stress, what's going on at home, and other things, because we want to treat that whole person. Another principle is that we want to use the healing power of nature when possible. So in that stomach ache example, it's not just going to be, here's an antacid, here's an antibiotic. It's going to be, what in natural medicine can we pull from that's really going to help? Another principle is prevention is the best medicine. And teacher as doctor. Sorry, I said that backwards. Doctor as teacher. So the Latin word for doctor comes from docere, and docere means to teach. So when somebody is going to their doctor, if you're not getting educated, you may want to think twice, because ideally a good doctor is going to be teaching you how to really be healthy.
That's wonderful. I mean, I love this real holistic approach to the healing process and to acknowledge the body as interconnected systems. So much ancient wisdom there, and that we're reconnecting to that so much more as a society now. It's fantastic. And of course, you can't beat Mother Nature. So if we can harness some of the natural remedies, no, it's a fabulous field that I'd love to learn more about. And I'm so excited to have you here to share some insights with the audience that I'm trying to connect with, which is really females who are in midlife, they're athletic, they're high performing, and they ask a lot of their bodies. And because of this, they're putting themselves under a lot of pressure and stress. Working with females like this in your own practice, what have you found are some of the main concerns that you come across?
So, midlife, if we're talking the woman who's like in her 40s, 50s, that kind of time frame, that is when our body is shifting. Sometimes we may be in perimenopause where our periods are now not regular, they're skipping around. Or maybe this woman is actually postmenopausal, or maybe she had a hysterectomy years ago. And these hormones, we think of them as just for, procreation, but now we're learning so much more how they affect your brain, how they affect your sleep. And so for these athletes that like you said, are demanding so much of their bodies with the strenuous exercises, and the long intervals of training, sleep I see as really a foundation of good health.
Yeah.
Um, and and so this woman who's in this age group, I often see that in my office where they're saying they're not getting good sleep.
Mm-hmm.
And that can be an impact of a drop in progesterone, honestly, is what I see,
Yeah.
or perhaps an estrogen dominance case.
Mm-hmm.
Um, Another scenario might be, which I think we're going to talk about in a little bit, might be talking about the adrenals. Um, and so adrenal issues can kind of look differently. It might be that they're too tired, and so forth.
Yeah, and well, let's build on that now, because obviously energy levels at any stage in life are important, and most especially if you are putting athletic demands on your body as well as everything else you may be dealing with, be it family, children, job. And adrenal fatigue, I find, is something that has been tossed around a lot, especially in the overwhelm of wellness information that we have out there. And I think it's an important one that people really understand and know how to diagnose and know when to not assume it's adrenal fatigue. So, what would you advise someone who may feel that they have adrenal fatigue because of poor energy levels?
Yeah. So I think my one of my favorite sayings that a mentor doctor had shared is, you want to test and not guess.
Mm-hmm.
Um, because that fatigue, it could be related to so many different actual causes. And while it'd be easy to be like, well, I think it's just adrenal fatigue, my advice would be to test. And so, testing the adrenals, it may be a simple, easy way might be that you just get a blood cortisol test in the morning.
Mm-hmm.
Um, and the range that I personally like to see best is around a 10 to a 15 level of cortisol. The reference range roughly is from like 6 to around maybe 20 on average. So I like to kind of see this in this more narrow range of 10 to 15. So if somebody has a cortisol level that is either higher or lower, we know that our adrenals are being impacted. And even a high cortisol level could, it's the start of adrenal fatigue. Your body is pumping out too much cortisol, and that is really draining and taxing on the system. And similarly, on the other end, I kind of think like Goldilocks, it's like you don't want it too warm, too hot. You want it just right.
Yeah.
And so a blood cortisol might be a good idea, but if the person really wants like the best test and really wants to fully understand their adrenals, then they would order a salivary cortisol test.
Okay.
The benefit of that is, well, actually a couple different things. First is, for all the people who are scared of needles, if you're scared of a needle and here you're getting your blood drawn, your cortisol is likely going to spike.
Yeah, good point. Mm-hmm.
And so now you're really not getting a clear picture of, is this how I am normally? Or was this just because I was scared? Or was I really stressed that day, driving to the lab?
Mm-hmm.
So the benefit of a salivary cortisol test is obviously it takes out the needle. So that's a good thing. And then the second benefit is that we're actually getting a four or five draws throughout the day where you're actually collecting your saliva at different intervals, starting in the morning and going until bedtime. So then we get to see this beautiful cortisol graph, and then we get to see the whole entire picture. Because ordinarily, cortisol is it's a good hormone. It's not evil. It's what helps us get up in the morning and be able to have energy.
Absolutely, yeah.
And then throughout the day, the job of cortisol is to just kind of stepwise progression. And so at night, you really want it to be low so you could go to sleep. So going back to that kind of sleep thing that I see a lot, even though I said, well, maybe it's hormones, it could also be cortisol being too high. causing insomnia at night, and we would need to bring that down.
Yeah, no, that it's so important to look after that. I mean, one of the areas that I would advise on is around, your pre-workout nourishment, and to making sure that your body's not overproducing cortisol to make up for a lack of, energy that you should be putting into your system in advance. So, you know, but of course, sometimes it's just we can't get a handle on that, or we're not quite doing it right, and that's when testing, as you say, would be vital. How can people actually get these tests? Because of course I see some of these online, you can order them at home. What would you recommend that people do?
To be honest with you, while I think the do-it-yourself movement is great in so many ways, I also think it's kind of scary because
Mm.
how is somebody going to even be able to interpret adequately? When you go to a professional, they're trained to see things that you're not going to see.
Yeah.
So I would actually advise somebody to find a qualified practitioner, whether it is a health coach who can order these things, whether it's their naturopathic doctor or their, functional medicine doctor, one of these professionals, and say, do you offer salivary cortisol testing?
Yes. No, that's, and you can't undermine the sort of wealth of additional experience they would bring that could help, cut through some of the, well, incorrect analysis perhaps by yourself, or, just not fully understanding what you're looking at.
Mm-hmm.
Um, Moving then just to another issue that I have seen some of my clients with is around digestion. And again, whenever athletes have some issues, particularly if they're endurance athletes and they're eating on the go, because of course they do these long events that need to be fueled during the event. And this can obviously put the body under additional stress as well to digest in circumstances when their blood's trying to supply their muscles. So ideally, you want your digestive system to be in the most robust shape possible. If there are issues that you've come across with digestion, what would you say are the main symptoms that identify digestive issue problems?
Yeah, great question. So I always pull out the Bristol stool chart for my
That's
patient.
that one. Yeah.
I'm sure, you probably have that memorized.
Yeah.
And so anyone can Google themselves, and it's a standardized chart of what stool, AKA feces or poop. Yeah. What that looks like. And so the Bristol stool chart will show you really what constipation looks like. That's like a type 1, type 2, where it's going to be small, hard pellets. A type 3 to 4 is going to look like a kind of a sausage shape. And then 5, 6 is more of a mush. Like the form has now started to be more mushy. And then a type 7 on the Bristol stool chart is full on liquid. And so looking at that, because somebody might say, well, and we're, overlooking, we should be pooping every day and possibly even more times a day. Do you have a standard? I know, like, do you think once is good enough, or are you aiming for 3 to 4, Roberta?
Yeah, I mean, personally, I would go twice a day, but at least once. And, I do know that some people would be, oh my goodness, how do you do that? But, I think another thing I've heard is as long as, well, you need to be regular, but also if there's too long a period between going, maybe someone's every 2 days and they've always been every 2 days. But I would say, as a rule of thumb, once a day. And I definitely do sit within this bio individuality, but I would want to work with someone. If they're not able to go every day, I would be looking at, okay, let's see where we're getting our fiber from, and maybe other stress issues that might be causing, concerns there, or medications and things that they're taking.
Mm-hmm. Yeah. So that's the stool, what it looks like and how frequent. That's really the basis of your digestion. And then I would say the most common thing that I hear in my practice is bloating.
Mm.
Like, and I have them and I say back, if I'm like, okay, well, bloating, like, what do you mean by that? Like, and I say, do you look like you're pregnant? Like, or is that kind of what we're talking about? And often it's like, yes, I look 4 months or 6 months pregnant. And
And this would be soon after eating their meal, for example, they feel this bloating, and then as part of the digestive process. Yeah.
correct. And so, and how you know if it's like bloating or versus like weight is that it kind of comes and goes. It's like you may wake up in the morning and you're like, oh, great. My stomach is flat, it's not sticking over my pants, that type of thing. But as the day goes on, if you're like, oh, my stomach is, more protruding, that is what we're talking about. That is the bloating symptom. And so that's when I would be thinking, is there a digestive issue? Or do we have nausea? Nausea can be a sign of a bacteria of H. pylori.
Mm-hmm.
So if somebody has also reflux. And, I think I always like to reiterate to people, never normalize your symptoms.
Mm-hmm.
If it's like, well, I always just wake up with a headache. I had a patient tell me, and I'm like, that's not normal.
But it's been going on for so long, but for that person, it's their new normal. But yeah.
Yeah. And so if it's like, oh yeah, I just take an antacid every day,
Mm.
that's not normal. And so signs like of acid reflux would be another thing. And all symptoms are really your body's way of communicating with you. And so I like kind of invite people to say, and I try to tell myself, like, thank you, body, for showing me that there's something going on. And this is my opportunity to dive deeper and to figure out what the problem is.
Yeah, to intervene. I know SIBO, small intestine bacterial overgrowth. Again, maybe it's just in the channels that I look at in terms of digestion, but this is something that's growing in popularity because of the increased awareness around it. And I wanted to bring that up today as something that, I think is more of a concern than maybe we've been aware of before. Are you seeing increased diagnosis of SIBO?
Yes, I feel like it's really a big problem. And I think that there's a lot of different causes, like slow motility is slow motility being the person that, like you said, goes every other day or something.
Mm-hmm.
Um, it can be a contributing factor, or even a digestive illness. If somebody had a bad case of food poisoning, that could set you up for getting SIBO.
Yeah, yeah.
And so the symptoms of SIBO that I see most often complain is that bloating
Mm-hmm.
and the constipation often, although it could go the other way and they could be more loose stool as well. And so the definitive diagnosis of SIBO would be a breath test.
Yeah.
And so many doctors can order this. And this breath test is often you're drinking a lactulose, like a substance. First, you also have to abstain from certain foods.
Right.
Um, and then after you drink this substance, you're breathing in to a bag, and that air is assessed at the lab to see what the level of methane and hydrogen is. These are two gases that are created by bacteria. And so an elevation in methane or an elevation in hydrogen beyond the normal would give you a definitive diagnosis of SIBO.
Incredible. Yeah, no, thank you for explaining that in terms of understanding the processing of it. And, I really do understand that digestive system, it's so crucial for us. I mean, we can talk as much as we like around all the healthy, fruits and vegetables and a whole, smorgasbord of beautiful, delicious food. But if our body isn't able to digest and assimilate it, what's the point? You know, forget the organic versus non-organic conversation. You got to get your digestion on point and to be able to bring these, you know, healing nutrients to your body.
Yeah. You know, we used to say that, you know, that you are what you eat. And I'm like, nope, you aren't what you eat. You're what you digest and absorb.
Yes, for sure. No, I like it very much. The other point I wanted to discuss with you today, of course, is, and you've touched on it with midlife and the change in our hormone levels, moving from, you know, into perimenopause, menopause, postmenopause, and really navigating those new waters, if you like. Something that really I think a lot of us haven't had many conversations about before we're actually in it. And I certainly want to be as prepared as I can be for anything that may lay ahead. What would you say if someone is experiencing the types of symptoms that may indicate to them, you know, imbalances in their hormones, be it night sweats, trouble sleeping, you know, mood changes? What would be good advice from your perspective on what they could do?
Good. I'm going to kind of take this full circle back to our conversation about adrenal health.
Mm-hmm.
So let's talk about menopause. Menopause is your ovaries have decided that their job is up. You know, they've come to retirement, so to say. Their services are no longer needed. However, so the ovaries often are making your levels of estrogen and progesterone, which are critical hormones for your brain function. Yes, they can contribute to your mood, heart disease, bone density. So these are a lot of things that don't just stop when reproductive years stop. So when they retire, guess who is up for the job? The adrenal glands are the ones that will actually help you make estrogen, progesterone, testosterone.
Right.
So we need, like, in the, you know, for those who are not yet in menopause, what I would say is let's be good to our adrenal glands.
Mm-hmm.
And so, and I'll talk about what, you know, if you're postmenopausal, but just, I didn't get to kind of share earlier that for the adrenals, I think what is really critical is a couple other signs for you to look for to see, like, are my adrenals an issue? If somebody goes from sitting to standing and they feel dizzy, that is what we call orthostatic hypotension. So meaning you've changed your, you know, you went from sitting to standing, and what in good health, your adrenals actually do help regulate your, the chemical is aldosterone that helps with your blood pressure. And so we should have a rise in blood pressure to meet that elevation change. If the adrenals aren't in good shape, they may not be able to do that. And so for the dizzy person who goes from sitting to standing and you get dizzy, that is a kind of a clue that your adrenals may not be in the best shape.
Oh, good. That's a good indicator to be aware of. And presumably that's equivalent. I know we're focusing our conversation for women today, but that would be the same issue for men as well.
Yes, absolutely. And so so to have good adrenal health right now, no matter at what age you're at, adrenal health, I think, is really important, especially the year that we've all just had with the levels of stress. Because your level of stress will impact your adrenal glands. And so a few things, you know, if somebody's a note taker, I'm going to say a couple of things about adrenal health. One is make sure you are getting a good amount of rest. I do subscribe to the 6 to 8 hour philosophy, because that's giving your body time to repair. You're not repairing when we're doing our work, because your body's doing other functions. But when you're sleeping, that's when it's repairing. Number 2 is healthy blood sugar regulation for those adrenal glands. So depending on what that looks like for you, if if somebody gets like lightheaded or shaky
Mm,
without meals, their blood sugar regulation is off. That is putting increased demand on those adrenal glands to
mm.
tell the liver to release the stores of glucose. You don't want your adrenals having to do more work for you. You do your job of blood sugar regulation. And what that might look like is that I'd say, your audience is probably working with you and you're helping educate them on what that looks like for them. But it might be, regular intervals, not skipping meals,
Yeah.
and eating.
Pre-fueling ahead of workouts, post-workout refuel, keeping your kind of blood sugar level, good amount of protein throughout the day as well to help deliver that at a more even rate.
Yes. And then I'm going to say this is the third and final thing, just to keep it short and sweet for adrenal health, is having a practice of almost quietness, if you will.
Mm.
So whether that's a like a prayer time or a meditation time or a deep breathing time, and it could be as little as like a minute. Like, okay, I'm just going to have 1 to 5 minutes just to focus on my breath, because that deep breathing is actually activating the relaxing part of your nervous system, which
Yeah, the
then
parasympathetic. Yeah,
yes.
yeah.
And just to end on parasympathetic versus sympathetic, the way I like to think about it is, when I was in school, I was having a hard time keeping the two straight. And so this is what I came up with. I was like, well, when you're in Paris, it's all relaxing. You're resting and you're digesting because you're eating food and you're sitting at coffee shops. So that is parasympathetic, rest
Nice.
and digest. And then sympathetic, I kind of think like that's the stressors. You still need this, but this is like the gas pedal. Parasympathetic is like the brakes.
Oh, très bien. I like your analogy there. Very good. Yeah, I mean, I think, again, this makes me think of, meditation and how trendy meditation has become at the minute, but there is real science behind this. And I love that you said it could be as short as a minute. It doesn't have to be this, oh, I need a quiet space, I need my yoga outfit, I need my candle burning, and you could be locked in your bathroom, just having that 1 minute to yourself, no distractions, and there is real change at the biochemical level going on in your body when you honor it in that way. No, fantastic insights there, Alisha. Really great. And I know we could go on and talk for a very long time, but I think that there's been some real nuggets that people can take away and hopefully has given them some food for thought if they are experiencing any of the symptoms that you touched upon. I do know that you do go into more detail on menopause, particularly through a resource that you have on your website.
Yes. So I wanted, women suffering from menopause to be able to access, you may not have a naturopathic doctor in your area, but if you're suffering from menopause and you want to know, you don't want to have to scour the web to educate yourself, I've compiled it in this great kind of short data point so that you can have what labs to order, what supplements I use, and so forth.
Oh, that's fantastic. And if people are interested in looking at that or reaching out to you with any questions or wanting more information, how can they connect with you?
Oh, yes. So the best way is to go to my website, which is Dr. Just the abbreviation, Dr. Alisha, ALISHAND, like naturopathic doctor.com. So dralishand.com. And I do offer a free 15-minute phone consult. So if you guys had any questions, I would be, happy to be a resource for you. And we can set up that free 15-minute consult right on the website.
Oh, that's great. I will put those details in the show notes at the bottom. Now, my business is called Your Healthier Lifestyle because I believe that health is a journey. It's not a destination. And we're all on our own personal journey towards healthier and whatever that might look like to each of us. So I always like to ask, what are you doing for your own personal health journey that might inspire those watching and listening?
Okay, so I'm going to get a little bit personal here. So the answer is that I am on a no sugar kick, like not even any honey,
Right.
or maple syrup or anything like that. And what prompted me to do that was one, because sugar is very addicting. But number two, this is the really personal part, is that I've had a rash like on my body,
Mm.
and it was a fungal based rash.
Mm. And I
And
love sugar.
yep. And so yes, fungus loves sugar. It's not because I don't, like I'm clean. I shower. But really, I looked at that symptom of the rash being a fungal based rash, which I'm just prone to, unfortunately. I need to get kind of delve deeper into that.
Yeah.
But so I decided I have to stop feeding it.
That's it. Yeah. You are what you feed in some way. I mean, I look at us as this ecosystem that carries around all our microbiome of, life. And they will drive our behaviors in many ways. Again, another conversation. But thank you for sharing that, because, these things, I think the more we talk about it, the more we bring it out into the open, the more people start to get comfortable discussing it, exploring it, and seeking the right support. So thank you so much for connecting today. It's been lovely to chat, and thank you. Have a wonderful rest of your day.
Thank you. You too.
Bye.
Bye.